The OB/OR committee was originally formed to essentially bridge the gap between the two departments. We do have a common goal, and that's getting through surgery safely, delivering baby safely, mom gets through surgery without any complications, but we definitely come at this procedure or case or baby delivery from different angles.
This quality improvement project was important to the OB department because we strive for excellence and, patient satisfaction. That is on every single person's mind. It's kind of a vulnerable time for the patient, and so we just want to make sure that their experience is the absolute best when they're in our care. The surgical services director and I, we kind of get to step back and see these frontline staff work together, sit back and watch the magic happen, watch all of them work together and create amazing things.
There's a lot of information that needs to pass between the two departments and very fluidly. That often can create a barrier in the continuity of the patient care. And this format of letting staff talk at a basic level to really understand where each side is coming from really has helped to create an environment of comfort from both angles, because now we know what to expect from each other.
This project definitely has allowed us to train more and be more well prepared for a C-section, whether it be urgent, stat, even scheduled. So we can provide that great care so close to home.
With working with another department between OB and OR, that we needed to come together and collaborate on how we can be united together. Also how to have the best outcomes for our moms and our babes.
We have two departments that work separately, and then in crisis situations we have to all of a sudden collaborate.
We did conduct these C-section walkthrough drills, and that was really to just get a baseline of where we're at with all of these changes that we've made to enhance this experience. Where are we at? And providers participated, RT staff, OB and OR staff.
The staff that have really taken part in setting up these drills, opening up the avenues of communication, really do deserve a lot of credit here.
I think we've learned, it's been a very eye-opening. Not only that, you learned from an OR standpoint, like why these sections and these steps are very important. And then they learned from an OB standpoint, like how much it takes to get a patient ready for the OR. So I feel like you have a better unity because of the fact is we understand now where they're coming and all the whys behind it.
Being a part of this allowed me to go over and see exactly what OB does to get a patient ready for a C-section, which is, an astronomical amount of things in such a short amount of time, and they run like a well-oiled machine over there.
Nationwide, the goal for stat C-sections would be to have the baby out in 30 minutes or less. And so we were really pushing that 30-minute marker prior to the team, and now we're well under it. It's been a combination of checklists, it's been a combination of equipment.
We are familiar with where things are when we come into the OR. If we do need to help, we know how to run the machinery if needed, and we know where supplies are if we need to get extra supplies for the OR staff.
I created a debriefing with every section that all people involved would fill out. Then this way we could collaborate on what we did well, what we need to improve on. But also I ask our patients too, like, how did you feel it went? Was there anything that you think that maybe we could improve on so we can make it a better process for them too?
I think that if someone in the community were to come up to me and say, how do C-sections go there if I'm considering delivering a baby at Crossing Rivers? We can speak to the fact that we're doing regular drills that we practice many different scenarios constantly to increase the comfort and confidence level of not only the nurses, the techs, the surgeons, the anesthesia providers, so we're ready for those scenarios when they come. And I think that if you were talking to a member of the community and they heard that we were regularly drilling and practicing these scenarios, it would definitely increase my comfort level as a potential patient at this facility. And it's really something to be proud of, that we are going above and beyond to provide the best patient care possible.
You know, a committee like this it's an ongoing process. It's not something that you meet a couple times and then all the problems are solved. You know, every time we meet, there's new things that come up, and you know, it is going to be a forever ongoing project to try and collaborate between departments. So, you know, it's a lot of work, but I think it's worth it.